Now, let me today tell you about one method of differentiating between extravascular hemolysis and intravascular hemolysis. Now, both these conditions they cause hemolytic anemia, in which the RBCs they actually break down before completing their life of 120 days. So this child would be having some form of pallor and jaundice as well. Jaundice because when the RBCs are broken down, this hemoglobin would be converted into biliverdin, and that would lead to an indirect hyperbilirubinemia. So a child who has got anemia along with jaundice, then the next step is that in this hemolytic anemia, you have to differentiate whether this is an extravascular or intravascular hemolysis. So one simple clinical thing that can differentiate between intravascular and extravascular hemolysis is the presence or absence of hemoglobinuria. So remember, hemoglobinuria actually only presents in intravascular hemolysis. So these child would be having either a sort of a cola or tea colored discoloration of the urine, or even if the urine is fine and you do a urine dip and that is positive for blood, then you have to check whether this is because of RBCs or whether this is because of hemoglobin. And if the test comes out positive for hemoglobin, then it means that you are dealing with a condition that is causing intravascular hemolysis. So intravascular hemolysis only occurs in a few conditions like hemolytic uremic syndrome, thrombotic thrombocytopenia purpura, and a few other conditions, while extravascular hemolysis can occur in a wide variety of conditions. For example, it can occur in hereditary spherocytosis, it can occur in sickle cell anemia, and there are so many other conditions. So remember, one method of differentiating between intravascular and extravascular hemolysis is the presence or absence of hemoglobinuria. So hemoglobinuria is only present if there is intravascular hemolysis. So keep this clinical tidbit in your mind. Okay, that would help you simply differentiating between whether the cause is coming from intravascular causes or extravascular causes. Have a very good day. Bye bye.